In equine assisted physiotherapy, each position is chosen for a reason and always adapted to the child's developmental needs. In this session, a baby is carefully positioned in 4-point, kneeling on the back of a calm, stable equine. This posture invites weight bearing through the hands and knees, supports core activation, and encourages head and trunk control. The equine is standing still, allowing the therapist to focus on alignment, balance reactions, and sensory input. Gentle manual cues help the baby find midline and explore movement within a safe, supported space. The gentle and rhythmic equine movement, the therapist's touch, and the grounded environment create an ideal opportunity for neuromotor development. None of this is improvised. It is physiotherapy, specific, intentional, and guided by deep knowledge of early motor patterns. This is equine assisted physiotherapy, where clinical skill meets the quiet power of the equine. Scan the QR code to learn more in the Equine Assisted Therapy Clinical Specialist course.